It's a little different. Not all critical access hospitals are this way. Be prepared to be, in some of them, the only person. At this facility, I am it. Hi, my name is Wendy Briggs, and I'm a travel nurse for Atlas MedStaff. I've been an ER nurse for 38 years. I've also been a transport nurse, did some fixed-wing air ambulance flights. I have worked all hospital settings, everything from a level 1 trauma center all the way down to critical access hospitals. I like the break sometimes with the critical access hospitals, and I like the things that we do that are outside the norm. As an ER nurse in a critical access hospital, sometimes you do things that you wouldn't do anywhere else. The hospital that I'm at right now, we're a 2-bed ER, and we're very, very rural. We're 3.5 hours from the closest major medical center. So when we have a critical patient, we hope that the airplane or the helicopter can fly in and pick up the patient, but that's not always the case. So the nurse or one of the nurses could be going in the back of the ambulance the 3.5 hours down the road to the closest big facility from us, which is Reno. If the weather is too bad that you could be taking care of a patient for an extended period of time that may be critical. A lot of people think that the small hospital is not as busy and you don't get anything bad, but that's not the case. You have to know your stuff and you have to be comfortable with it. You're it. We provide a service for a community that we are the only medical care that they have. There's a clinic for doctor's visits, but if they cut their hand, if they break a leg, if they're having a heart attack, we're it to stabilize them and get them to a bigger facility. You also may be doing outpatient labs for the clinic. You have to draw the blood, EKGs. This is in any of the smaller hospitals. They just don't have the services that every place else has. Dressing changes, daily dressing changes for members of the community. There's a lot of things that go outside of what a normal ER nurse would do. Even sometimes a normal med-surg nurse if it's a smaller hospital. But it's phenomenal. I would encourage you that if you are looking at a critical access hospital, that you do an interview and ask questions about what the expectations are for what you will be doing. It's a little different. Not all critical access hospitals are this way. Be prepared to be, in some of them, the only person at this facility. I am it. When a patient comes in, I have to register the patient. I do all of the care. I put all of the orders in, call lab, and call x-ray. Some critical access hospitals I've worked at, there was 2 RNs. Sometimes there was an RN and a paramedic. Sometimes there was an RN and a tech. When you're looking at critical access hospitals in rural areas, you need to know where's your closest big facility, transfer options, your options for who else are you working with, and if something bad comes in, what do you do? Who do you call? Do I have backup? It's different, and you have to go to that mindset, but it is amazing, absolutely amazing to work in this environment and have the community just love you and support you, and to be able to do the kind of nursing where you get to do a little bit of everything.